Hello, everyone. Thank you so much for joining us today. We're going to go ahead and get started. First, just some quick reminders. First of all, there is translation available. If you need translation, please select the interpretation button at the bottom of the screen. That should allow you to select your respective language, as we will have presentations in both English and French today. Another reminder is that please continue to add questions into the Q&A function as the presentations get started. That will allow us to move right into our Q&A session and engage in a really dynamic conversation with our three panelists today. I'll start off then with some introductions. My name is Dana McLaughlin. I work on the Global Health team at the UN Foundation, and I'm really pleased to be joined by three esteemed panelists today. I'll start off with just some brief introductions. First, we have Juliet Odogu, who is the Executive Director of eHealth Africa. Juliet is joined today by Dr. Mohamed Saran Konde, who is a project manager working with Catholic Relief Services on a Global Fund Malaria project. And lastly, we have Robert Krieger, who is a country technology services manager with the Global Fund to Fight AIDS, Tuberculosis, and Malaria. So as I mentioned, we're going to be moving into some opening remarks from each of the presenters, but please add your questions to the Q&A function so that we can move right into a Q&A discussion after their opening remarks. So with that, I'd like to introduce our session today. Today, we'll be speaking about how digital technology is offering cost-effective ways to help address complex health challenges like malaria, whether it's reaching or training healthcare workers, using mobile tablets for data collection, or setting up digitized data systems for real-time monitoring of malaria. Mobile technology is a powerful tool that can be used to improve the speed and accuracy of data collection, enable analysis of complex data, and increase adherence to malaria treatment guidelines. Our panelists today will discuss some of the many ways that they harness the power of innovative digital solutions to tackle complex health challenges in their respective fields. So with that, I'm pleased to give the floor to our first panelist, who will be providing opening remarks and discussing some of the ways that she uses digital solutions in her everyday work. Juliet, the floor is yours.
Sure. Thanks, Dana, and welcome everyone. So today I will take a few minutes to talk through some of our project experiences at eHealth Africa, really leaning more on, I think, the second part of the topic today, which is more around the multi-sector collaboration, and where we've also infused some digital health solutions to really drive an integrated delivery approach or integrated health system approach. And I'll try to do that really quickly. I know I have just a couple of minutes to talk through a couple of project experiences. Today, well, I was able to summarize some of the lessons learned that we've gained over the last couple of years of implementation at eHealth Africa. And I'd like to talk about three of those today. The first is to really achieve an integrated health system or health multi-sector collaboration. One of the really key things that we've had to do over the last couple of years is leverage existing public health governance structures as well as existing project infrastructure to really achieve efficiencies in new programs and achieve alignment between multiple subsectors and sectors as well as stakeholders. I think that this is a lesson that is not just peculiar to malaria, but really to every public health program. And one of the really successful ways that we've done that at eHealth Africa is actually how we utilize the Emergency Operations Center's structure from the polio program, and then expanded that to accommodate multiple disease management, multiple emergency response, to even programs like routine immunization, malaria, et cetera. So just to give a quick background, the emergency operations centers were set up to be, the physical point of contact for, polio eradication response activities. This was really a physical space that allowed different stakeholders to come together to coordinate vaccination campaigns, and really helped us to build a strong accountability framework for all partners and stakeholders. One of the benefits to this kind of structure is that, like I said, government and partners can meet physically and coordinate response. We're able to quickly share lessons learned, exchange lessons learned, and help with coordination of activities. And like I mentioned, it's a really important example of integrated approach to health delivery. So although we set up the EOCs for polio emergency response, since inception, the EOCs have been able to coordinate the government of Nigeria's response for Ebola, routine immunization, Lassa fever, yellow fever, measles, other vaccine preventable diseases, as well as malaria programming as well. And just to give you an idea of the scale, between 2020 and 2021, the EOCs in Nigeria coordinated over 195 campaigns across multiple disease areas. So this is really key to ensuring that we're able to see what other programs are working on, and we're able to mount a coordinated response. The additional benefits of having this kind of EOC structure was the ability for us to create a data team, which is a multi-partner, multi-stakeholder data team that comes together with different technical expertise, complementary skill sets from government and partners, and are able to collaboratively work on data for things like data collection, data visualization, and analysis that are very useful to multiple partners. So this particular data team sitting out of the EOC has worked collaboratively with supporting digitizing campaign planning at national and subnational levels. We're doing a lot of data analysis and like I said, data visualization. And it's really one of the key initiatives out of the emergency operations centers that has made polio campaigns as well as other campaigns so successful, and eventually in Nigeria contributed to the eradication of the wild polio virus in Nigeria and then subsequently in Africa. And so this is one of the really key things that we're really proud to show that has worked across multiple partners and multiple stakeholders. Two other points just on how we think about integrated health approaches. The second is really more around the designing of digital solutions. So at eHealth Africa, one of the things that we really believe in when designing and implementing digital solutions is that we need to think with integration in mind, and we need to build with integration in mind. And what that looks like is, while we're building a solution for one particular program, say routine immunization, we should be thinking in the long term about integration, interoperability with other solutions that are within the same ecosystem, but also looking at how we can use the same digital solutions in other programs like malaria or in other programs like HIV, TB, and because a lot of the digital solutions are trying to solve the same complex challenges, collecting efficient data at the last mile, showing visibility throughout supply chains or through the continuum of care, and providing the necessary data for decision-making to critical stakeholders. And so having that design mindset with integration and interoperability in mind really helps us to design solutions that are not just fit for the particular program or the particular problem that we're trying to solve, but really looks at how we gain that kind of multi-sectoral visibility, multi-sectoral support, and then also helps to really reduce redundancy, reduce efforts, reduce parallel systems, reduce cost of developing new systems across different programs, and it really supports increasing lessons learned. And the third point is just throughout all of our programs, one of the things that we see that is really critical to integrated health delivery is ensuring that there is visibility and accessibility of critical data that supports effective decision making. And so a lot of times when we support our government partners or other stakeholders, one of the things that we really focus on is ensuring that we have access to that data, making sure that data is accessible at different levels of program system, and then making sure that those data points are really going towards supporting decision making by government and partners. I'll stop here for now and allow some other panelists to chime in.
Thank you so much, Juliet. So many really strong opening remarks and points that I'm sure will come up a bit more in our discussion later as well. I really like your points about the reduction of parallel systems and the integration across disease areas. I think that's going to be a theme in this discussion today. So next, I will turn to Mohammed for his opening remarks. And in particular, I hope Mohammed can speak a bit about the Guinea country study that he has been leading and a part of. So over to you, Mohammed.
Thank you very much, and good evening to all of you. It's a great pleasure to be with you, to join you in discussion, to tell you more about the Guinea. and the campaign that we were involved with other initiatives, health initiatives, which have been conducted in Guinea. I wanted to start with presenting some background and some contextual information, and how we were able to capture some of the information and what we learned from this initiative. And I will give you some outlook at the end. So in terms of context, Guinea started this project in 2015 and was ongoing until 2018. But the agents who were sharing the information back to us, there were some complaints from the parents of the children who was telling us that all the medicine use centers are only for children. You seem to forget the adults, and I believe we were being forgotten somehow. So that's an element. The second aspect is we understood that individuals who go door to door to administer medicine to the children, and there are visits being organized, could be leveraged in order to improve a certain number of indicators, in particular the indicators for vaccination programs or the PALU program, and also for nutritious programs. And this will be quite relevant to have a multi-sector collaboration with other programs. Another aspect, which is also quite important, is that we faced sometimes some interferences from different activities being conducted by the Ministry of Health, because each time we were looking at planning of our campaigns or implementing some activities, there was always issues related to interferences. So we decided to work closer together on different programs and to see how we could better target the campaigns and take opportunity of those visits in order to undertake other activities. So we used some tools and we embedded needs and requirements from other programs. In the first instance, we also worked on digitalization on the different data. And as we have two major partners in Guinea, with the Global Fund, but also another project with the fight against malaria. So all those partners work together, and we met up together to implement these activities and share our resources. When we introduced that, methodologically, we decided to digitize all the information in order to have a better follow-up monitoring of those data. And there is also a pilot project which was funded by Gambia with similar stakeholders, agents from the CPS who were working on those activities. And in another region, we found some individuals, thanks to Gavi, who helped us in order to share the resources. And in terms of the outcome, we realized they were very encouraging, and that enabled us to have some really startling data information on cases of malaria, over 15,000 cases, which accounted to 10% of the total amount of who had been identified in the last 4 months. So when we compared that, which that campaign was done over 5 days, and through that we were able to touch on 10% of what the locals could do over 4 months. So over 4,000 cases had been confirmed through that activity, and 4,958 cases, i.e. 7% of what had been identified over 4 months. And this was done over 5 days. And in terms of individuals who had been referred for DPI and the mosquito nets, quite a few pregnant women had been identified, but also been put forward for immunization program. And we were also able to target some children in the immunization process campaign. Over 5,400 children under the age of 1 who were able to benefit not only from the immunization but also from were able to have long-lasting insecticidal nets as a result of this intervention on the ground. And some serious cases were also identified. So about lessons learned, we note that the screening was able to identify the number of serious cases due to fever and other aspects. So as you know, when we started the CPS, every time we found a child with fever, he was excluded from the community, and then we did a screening test to identify the reasons why. Was he suffering from malaria or not? And once this was negative, we were able to exclude that child, and the number of exclusions were actually quite reduced. And we understood that sharing resources was a way to bring the needs and identify the needs from other communities and look after them. We were able to test other communities. The community-based vision was improved, and we understood that sharing resources should not only be on the opportunity, the cases, but also has to integrate the fact that the material and human resources have to be put together and shared. And by working and sharing resources, we can generate some savings and gain some time in order to improve the multi-sector collaboration. And it's a win-win situation, and every aspect of the Ministry of Health's programs could find benefits and advantages of that. In terms of outlook, digitalization of the data was an important factor, because when we started that, it wasn't just thanks to the Global Fund through various events, but in terms of outlook, all CPS areas were able to be looked after by a community health worker for each of the team, and we want to enhance that collaboration. We also want to increase the sharing of resources in the medical centers, which was also a difficulty in terms of sharing the inputs or and another lesson that we learned, which was very interesting, is that we understood that through the digitalization of the CPS and the aspect of sharing resources was a way to learn a lesson which are helpful today in order to work further on digitalization through the national campaign to distribute the nets. And we saw the advantages of that. This is what I wanted to share with you, and I would be happy to answer your questions as soon as we get to that point.
Thank you so much, Mohammed, and great to hear some of those lessons learned as well. I think that will be a great part of our Q&A discussion as well. So next, we're going to move to Robert Cryer, who can speak from the perspective of the Global Fund, which, as many of us know, is a strong supporter, a longtime supporter of digital solutions for health programs. So Robert, over to you.
Thanks, Dana. At the Global Fund, I'm the part of the Country Technology Services team, and we advise and guide our country team colleagues on the the best way to invest in digital health technologies and to try and make sure that we get the most effective results, or at least the results that are envisaged when the projects are put together. And one of the key things for us is to take a broad view or a holistic view of the solution that wants to be put in place. And by that, we're not looking necessarily particularly. What we want to try and avoid is specific, for example, a dedicated, focused, for example, a malaria intervention, where something that has a broader scope or fits with existing technologies or existing solutions that are there in country. How does this work well together? Also, often an additional point that is not considered when we're looking at this is, for example, and I know my other panelists have touched on this as well, is do you actually have the power at the clinics where you want to put in this digital intervention? Do you actually have internet connectivity, and how reliable and how stable are those connectivities? Because without that basic infrastructure piece being put in place or assured to be in place, you're not going to get the results that you hope for. And that doesn't mean to say don't do it. It means to say that as part of the project plan, as part of considering how to approach this intervention, you need to consider these additional points to make sure that that they are in place, or you have a plan to support them. The other piece that we also look for is really around the sustainability piece. It's quite often the bit that gets people energized and mobilized is the project itself. When people can see putting in this intervention, we can easily see the benefits that you're going to get from that particular intervention, but not necessarily looking at it for a 3 or 5 year period around how do we sustain this? Where do we have the funding, not just for the capital investment, but for the operational run that is required here, and the people that are going to be required in order to be able to in order to be able to continue with system support, with maintenance that has that longer 5-year view. On top of that, there's some other things that we see that have been very powerful in reducing the risk and leading to better successful outcomes. One of which is strong governance. But if you have the right governance in place, if you have the right drive in place, and you have the stakeholders supporting what it is you're trying to do, you have a much better chance of being able to overcome obstacles and to be able to drive the project through to completion. One thing where I think the Global Fund will sort of hold our hands up in saying where we do need to do more is also in coordination between, even within the Global Fund, between the different diseases, but also with other donors, to make sure that we are that if there are interventions, that they are working in harmony with what with the country, and that we're not leaving gaps between the solutions, or we're not overlapping and pulling in different directions. And the final thing for me would also to be looking at or having a preference for using global goods, primarily because we're looking at their tried and tested solutions that have, if you like, been debugged or have been shown to work well in country, in the situations where they're most needed, as opposed to building yourself. That for us is really more of a last resort, unless there really isn't a solution that is available that you'd want to build it. But we do see a tendency for people to feel that they want to build it themselves, to take that real sort of ownership of it. From our perspective, if you want to something that's going to be less less prone to issues, and something that you can bring faster to apply, it is using something that is a tried and tested global good. Thanks, Dan. I'm back to you.
Thank you so much, Robert. So 3 very different perspectives, but equally important reflections and sharing of lessons learned. I think the unique part about this panel is that there are clear lessons learned on all sides of this implementation process of digital solutions. And I think we're privileged to hear many different perspectives here. So again, I'd encourage you to add any of your questions into the Q&A function. Seems like we're at an absence of questions right now. So I guess that means I get to ask my questions for the panelists. So I'm going to actually start with Juliet and go back to a point that you mentioned about the essential role of the emergency operations centers, and understanding from your comments that those centers were set up to be the kind of points of contact for polio eradication, but have really, those centers have taken on a larger role in informing and being a center hub for data sharing and coordination. So I'd love if you could speak a little bit more about what those centers did during the pandemic and how their role moving forward into even coordination of data sharing and infection detection, how you see those centers being used moving forward, especially as there's so much conversation right now about investing in infrastructure like these centers that can help with future health crises detection and kind of polyvalent health data systems. So great if you could talk a little bit more about those emergency operations centers.
Thanks, Dana. And I mean, you hit the nail on the head. One of the things I actually didn't mention in the opening remarks is that when the COVID-19 pandemic hit, the emergency operations centers stepped up and actually became the command centers for that response, before maybe more long-lasting structures could be set in place. And that's one of the benefits that we see to having a space or a forum or an avenue where different stakeholders, multi-sectoral stakeholders can collaborate and plan and implement emergency response. And so, that's one of the things that we've gone on even from Nigeria to implement across multiple countries in Africa, one with the view of kind of setting them up as a response center for polio, but also taking a broader view to see where we can provide alignments to support that's going on elsewhere. One of the things that does is it harmonizes resource management, right? So reduces parallel systems, like I said in the beginning, and ensures that stakeholders can make additional investments to optimize those centers as opposed to creating additional centers for different programs. And I think it's something that's been backed by the government of Nigeria and other countries. It's something that other partners are starting to see the value of having those. And investments are now being collaborated, from different stakeholders and poured into the emergency operations centers, because we know that that's a key infrastructure for emergency response. One of the things that the EOCs also do, even while, yes, the primary function is to respond to emergencies, but even in between, emergencies or where there's a seeming sense of stability, is really around improving surveillance and predictive modeling. So enabling those data teams or technology teams that sit within those centers to really focus on using the data that's available to conduct complex analyses, understand trends, understand disease trends, and be able to predict to a fair degree how these diseases are moving, or also be able to guide implementation across multiple diseases, and also leveraging data from different program areas to paint a more holistic picture of the public health landscape. And so I think that's one, another crucial benefit of having such a pivotal center that not just looks across one program, but is able to look more holistically.
Thank you so much, Julia. It's really great to hear. And it actually ties into something that Robert said around strong governance and also lesson sharing between countries. Obviously, this is something that has been a critical aspect of Nigeria's work in this area of data sharing and coordination of emergency response efforts. So that's really fantastic to hear that those lessons are being shared and multiplied and replicated. So next, I'd like to move to a question for Mohammed. Mohammed, you spoke a bit about the effective screening of fevers, especially identifying the reasons behind those fevers and promptly diagnosing them for the correct illness. And I was hoping you could speak a little bit more about how these data solutions that you've implemented and been a part of in Guinea and beyond have enabled healthcare workers to cover more of the population, especially with last mile communities. I was hoping you could speak a little bit more about how those healthcare workers are able to respond to fevers more quickly and to diagnose and properly record those fevers and diagnoses into surveillance systems because of investments into the healthcare workforce. So could you talk a little bit more about how you've seen that play out in Guinea and in other countries that you've worked in?
Okay, many thanks. I think that this is an excellent question regarding taking charge of the particular cases and campaigns and the SMCA campaigns. We have what we have wanted to set up here in terms of fever is to train, first of all, anything that has to do with the implementation of the SMCA campaign. Most of that are the communities. So therefore, even if you're not in an SMC campaign, we have some visit at home in order to look for fever cases and in order to also be able to screen them, test them, and treat them. And if there are serious cases, then they'll refer to the health center. As I mentioned, in the contextual background elements, what has really led us to integrate this is the fact that we had many such cases and decisions. And secondly, the parents and adults that were complaining that only medication was given only to our children, and we said that as we had some children also, and also adults who fell ill because of fever, so that all of these cases should be taken into account and dealt with within the community as part of their normal activities. So all of these screened cases were then mentioned in these registers or in the relevant systems where all this data was entered, and that is how this took place. And this has also enhanced the collaboration between people involved in the health service as well as the communities which were complaining about the health activities that were exclusively based for children under 5 years old. So it was a very good experience in Guinea, and as I stated earlier on, we also intend to scale all these activities to a bigger scale throughout the country, including in terms of immunization. Many thanks.
So next I'll turn to a question for Robert. We know that the Global Fund is developing their new strategy, stemming from many of the points that you made about optimization and sustainability of investments. Do you think that the Global Fund will allow for more integrated digital platforms moving forward? And how might that build on lessons learned from the digital solutions that were deployed during the pandemic because of challenges of in-person management? And so we'd love to hear a bit more about your thoughts about the Global Fund's work under the new strategy.
Yeah, thanks, Dana. So one of the things that we are particularly looking at is for us the most optimal way of collecting and using data and making sure that the burden that we're putting on countries is as minimal but as focused as possible to ensure that we're getting the information that we need without excessively, because we understand that the over requirement that would require. One of the things that we also I think are not doing as effectively as we can do is working again with other donors and looking at that whole data gathering piece to make sure that we're not asking the same question twice, or we're not asking the same question in two different ways, which requires a separate, inefficient way of collecting the data. This we're also trying to balance with one of the things that again is becoming quite topic of conversation right now is when we've looked at the data or the reports that we get back at the Global Fund. They're often 6 months in preparation, and so the data that we're reviewing is for the situation 6 months ago, and there's been an understanding or an acceptance of I think of that point up until we now see with the impact of COVID and the ability to really start to bring data in a much more real time or a much more timely manner than we'd seen previously. It's then starting to ask the question about how can we start to get data much faster and much more accurately, but again without increasing that overall burden on the countries in order to be able to supply that. And one of the ways in which that we've looked to do that is to do more effective and more coordinated data capture, but more digital, to do it much more digitally rather than a lot of the manual processes and the review processes that go on. We want to try and see how can we effectively speed up and digitize or automate those processes so that the data flows more seamlessly than it does today.
Thank you so much for answering my question, Robert, and for honing in a bit more about the importance of the coordination between donors. I think that is definitely a huge lesson learned as the Global Fund moves into its new strategy period, and hopefully a lot of that feedback has been heard from country programs and implementers as well. And great to hear that you are prioritizing that. So there's a question in the chat for Mohammed, which is saying rather, thank you for the results on the SMC campaign in Guinea. The question is, for the cases of febrile children who received the RDT and also this back test, was there a referral system for the cases of febrile children, or is it the systematic RDT? And then also asking, apart from the RDT, is there a referral system in the health center for children with the fever during the SMC campaign in Guinea? So Mohammed, could you take that question?
Yes, thank you very much for this interesting question. So indeed, I was saying before mutualization, before sharing the resources, all the distributors were subject to funding. And once you are aware of the referral system, quite often it doesn't come to an end. And there are the transport issue, which can be a big issue for them, for patients being referred. And the rapid tests were done exclusively for those individuals. And once the tests are negative, they are not excluded. And on top of that, and the medicine was given, we would advise the mother and advise for the child to be referred to the closest medical center. So this is a system that was in place for the serious cases that were identified, were subject to referrals. Your other question, who was administering the medicine? So the community health workers who are involved with preventing and caring for malaria So their priority where there are community-based relays or health agencies who can look at those rapid test diagnostics. This is how it was done in Guinea. This is the answer I can give you. Thank you very much.
Thank you, Mohammed. So next, there's a question for Juliet. So we know that the EOCs are an important part of helping identify outbreak diseases and emergent infectious diseases. However, malaria, even in high burden countries and endemic areas, we often see hotspots and outbreaks. Do you think that the EOCs can ever be scaled up to have the functionality to identify malaria hotspots? And perhaps maybe that's something that they already do. So if you could speak a little bit more about that.
Thanks for that question. I think that there has to be some sort of hybrid approach to addressing this. I believe that the current malaria systems or surveillance systems that we have, I mean, and probably different in different countries, but are really robust and comprehensive in terms of helping us collect the necessary data on a routine basis that helps us to do this kind of identification of hotspots. And then, you know, we're still kind of progressing to the point where we have the more complex systems that are actually predicting outbreaks. I think where a structure like the Emergency Operations Centers comes in is really being able to take some of that data and proactively plan for implementation or, you know, outbreak response, as we call it. So whatever, you know, mass drug administration campaigns would need to happen for the malaria program or other kind of interventions, using a structure like the Emergency Operations Centers is where I think we'll really find the kind of the value. One of the other things that this does is that it helps us to leverage other programs, outreach structures or systems for malaria as well. I know that, routine immunization has similar outbreak response programs or immunization campaigns. And so being able to use this structure to share lessons learned from other programs, also understand their calendars and their schedule in terms of going out into communities, one would help to make sure that we're using the available data more efficiently. We are deploying limited resources into communities to deliver life-saving interventions in an effective way. And at the end of the day, we're not just dealing in silos, but we're actually implementing a collaborated or integrated approach to health system delivery. And so I think that's really the value that kind of coordination mechanism brings into play for a program like malaria.
Thank you for clarifying that, Juliet, and great to hear how versatile those systems are. So on a related note, something you actually mentioned earlier, and I can't help but think Robert probably also has a lot of thoughts on this, is the importance of data sharing and accessibility and visibility for supply chains. And as that pertains to both malaria and malaria commodities, but then also beyond malaria across the other diseases that the Global Fund supports, so HIV and TB. And then even beyond that, how have some of these new digital solutions and greater accessibility sharing of data enabled you to predict bottlenecks and shortcomings in the supply chain system? And how have those things been addressed? And in what ways have you had to pivot to really use the data that's being collected about supply chains to implement effective solutions that allow you to get the commodities to where they need to be? So maybe I'll let Juliet, you take that first, and then maybe over to Robert for his perspective on the use of data for supply chain visibility.
Thanks. Yeah, I think that data availability of the right kind of data has been one of the most critical things that has helped supply chain visibility, not just in malaria, but again, across public health programs, and the ability to collect real time or near real time or data that's useful for decision making is really the challenge that a lot of digital solutions have been trying to solve. And even at eHealth Africa, we have developed a number of digital solutions that collect data from the last mile, you know, understanding how commodities are coming in, are being used. And really the purpose of collecting that quickly and effectively is to be able to give decision makers at higher levels, you know, that rapid understanding of how, you know, how things are moving within the supply chain, and are able to identify stockouts as they're happening, or even predict stockouts before they happen, and then be able to target interventions there. And so I think that's the biggest thing that digital solutions have brought to the supply chain, is being able to provide that kind of really quick turnaround in terms of understanding what's going on, even down to the last mile. And I think that if we look at a solution like the DHIS2 that has, you know, become really pervasive in most countries' public health systems, that not just only kind of then gives us the data that we need for long-term program planning, but it also gives us data across multiple programs. And then you can really use that as data to understand the relationship between different programs, really looking at it from the health facility level, but, you know, being able to aggregate that to understand trends on, you know, what's going on in supply chain, in commodity availability, and how that's also affecting some public health outcomes. So I think on different levels, you know, across the different levels, you know, for transactional data versus program data, there's definitely value to having those smart systems, digital systems, and availability of data to really improve supply chain visibility across board.
Thank you, Juliet. Robert, do you want to come in here about some thoughts around supply chain visibility?
Yeah, and I think one of the things that, again, is something that we're actively working on at the Global Fund is around how do we digitize, particularly the LLIN distributions, where at the moment we're very much pushing to try and get the QR code on the bale and on the bednet, and so we're able to track much more clearly where the bednets are within the supply chain system, and to be able to manage, for example, the stockout issues that Juliet was just referring to then. But also in doing that, one of the things that we really want to take it down to a community level, where we can see for each dwelling, you know, how many bed nets have been distributed to a particular dwelling, and actually, in terms of sort of data use, then you can look at that. Obviously, then very much supports the supply chain, but also can inform, you know, other programs. I think there's, again, the point that Juliet was making there about, you know, the the size of the cohort or the community that you're dealing with, and exactly where they located, and can we use that geospatial data for other purposes other than just the resupply of the bednet. But one sort of caution that we have in looking at this is we then start to get to uniquely identifiable data, and the question around privacy then becomes more and more a concern, that we need to make sure that when we are collecting this data, it is collected in such a way that it can't bring any harm to the person that supplied the data in the first place. And what compounds that is often the data privacy regulations in some of the countries with which we work aren't sufficiently clear on these points as to be able to guide nationally what is the position for that. And one of the things that we're also working on then at the Global Fund is to say, well, what's the Global Fund's position on data privacy, and how should, if we are supporting a program, what should our data privacy position be in order to try and to support this and to protect the people that we're trying to serve. Mm-hmm. Thanks, Dan.
Thank you, Robert. Mohammed, do you want to come in here, or do you have another point to make on this this question?
Yes, precisely. Yes, I just wanted to confirm what Robert was saying. in terms of digitization of the supply chain. So as you know, Guinea is currently working on a new campaign, which is related to digitalization at community level. So we digitalized not only the registering of the households, but also the distribution phase. And the recommendations issued by the Global Fund was to also introduce digitalization for the supply chain. So we worked on that at the HIS2. There is a module for that in order to trace the nets from the distribution sites to the sites and to have a better monitoring and better tracking of those nets. And also with the water aspect, so to enhance the monitoring and the tracking. There was a question on the contribution from the private sector on that particular project, which is the digitalization for the campaign Maldam. We were to send SMS to households about the sites, distribution sites, and the dates when these were being distributed, and the household code information on the distribution sites, as well as a code for each household. So the Guinean state, via the Ministry of Health, worked on advocacy activities on the Orange Foundation so that they could accept and agree and consent for those SMS to be sent, because the cost is quite significant. So this is what I wanted to share with you on that particular aspect of digitalization, the supply chain, but also the contribution from the private sector in doing so. Thank you.
Thank you, Mohammed, and appreciate you transitioning us to the next question. I know we are kind of running up on our final minutes, so would encourage any last questions to come in through the chat. But in the meantime, I'll turn to Juliet to get her thoughts on the role of the private sector in making these improvements across sectors and integrating digital solutions. Juliet, over to you.
Sure. I think quickly, in addition to what Mohammed said, is really just contributing in terms of data gathering and contributing data that's coming from the private sector into overarching data systems to really improve the accuracy of some of our digital solutions and improve the accuracy of our information systems. And so while we know that the private, at least for most countries, the private sector caters to the healthcare of majority of the population, there's a lot of data that's being either not properly harnessed or not being properly harnessed from the private sector that we should be looking to integrate more, because that helps, you know, our ability to plan, our understanding of the population a bit better. And then also when we understand that, you know, the pharmaceutical sector has a large role to play in malaria programming, even in public health, then we realize that there is a significant contribution and partnership that we need to have in ensuring that we understand the medications, the medicines that are going down to populations, understand innovations and trends there, and are able to share or disseminate the appropriate medications that are improving, that will likely improve public health outcomes.
Thank you, Juliet. Robert, do you have thoughts on the role of the private sector? I know Global Fund has done a lot of innovative partnerships with the private sector, so it'd be great to hear your thoughts.
Well, just sort of simply, we can't do this alone. We can't do it without the private sector. So we need to embrace what they bring to the table, their innovation, and these are large and difficult problems that we need to solve, and we need their help. And in particular, one of the things, if I go back to my earlier comments about sustainability, again with the private sector, if we're able to construct good business models where they are able to engage, then that really helps in the sustainability of the particular intervention that you're looking for. So no, fully embrace what wherever we can use the private sector.
Mm-hmm. Absolutely, and making sure that they're also accountable for their commitments and their investments and their local impact is definitely an important point. So as we finish, we've just a couple minutes left. I want to ask, just for kind of a speed round of question, what excites you the most about the role of digital solutions? Just a super quick 30-second answer. Mohammed, can we start with you? So what excites you the most about digital solutions for health system strengthening?
Okay, I will try to. I am quite excited by the digital solutions and the how quickly we can access the data. As we are in a campaign, a MILDA campaign, and in very short period of time, we are able to access the data and we can see exactly what's happening on the ground. And this is very quite stimulating. And the fact that we can keep tracks and archives and keep hold of those data is quite relevant, because with paper-based information, we're never too sure about what could happen to them. So this is what excites me a lot when it comes to digitalization. And it's very helpful with the campaign that we currently conducting.
Excellent. Thank you so much, Mohammed. Juliet, over to you. What excites you the most in this?
I think to sum it up, is the innovation and the abilities that technology and digital solutions afford us. And I think particularly around prediction and being able to detect and understand trends. And I think just being able to then use that to either curtail or prevent certain outbreaks from happening. I think that, that is really powerful. And I think the more innovative solutions that we have that can do that would really help to just make sure that we have a healthier community.
Mm-hmm. Absolutely. I think it's so important to tie it back to the dignity and the access that people have to health and to staying healthy and living healthy lives. All right, Robert, your final response here. What excites you the most about these investments that the Global Fund is making in digital solutions?
I think just in digital health in general, the cost is coming down and the power is going up every year, and we can do so much more. It's just almost difficult to get your arms around all the things that you potentially can do, and the real benefit you can bring to patient outcomes by using the power of technology. And we're only just getting started, and I think that's a bit that excites me most, is there's so much to do and so much benefit we can bring. Excellent. Well, thank you all so much for your time. Thank you to all the guests for joining us today for this discussion, and thank you to our hosts, Catholic Relief Services, and especially to our panelists for taking the time to speak with us today. That is all. Have a great rest of your day. Take care.